So you know your inner thigh muscles are weak, and what you're used to doing is this. And you're thinking that actually works. And here I am telling you, it's not gonna work. So if you're interested, stay tuned. Hey, this is Dr. Shaki from Irvine Spinal Wellness Center, your Irvine Posture and Movement Clinic. Adductor muscles, the inner thigh muscles, are one of those muscles that are engaged with a lot of dysfunction in the hips and lower back. A lot of times people overuse the adductors to provide stability in their hips and in their SI joint, the joints back here, and in the lower back. So in order to really work out the inner thigh muscles, because they're weak, even though you use them a lot, they're shortened, they're exhausted from overworking, and they're weak as a result of that. The exercise to do, it's that functional movement exercise for the adductors that I'm about to show you. So Desiree, can you come over here? So what we're gonna do is I'm gonna show with my lovely assistant, Desiree. So you're gonna lay down on your side, and your ankle, your hip, and your elbow need to be on the same straight line. And you're gonna have to use a chair. So we're gonna use our table here. And you're gonna put your foot on the table. You're gonna have to engage your barrel. We've done a video on proper breathing. It's called biological breathing. We're gonna make sure we put it in here. Make sure you watch that video to understand what it takes to really engage your barrel properly. So we don't wanna trade one dysfunction for another. We wanna do this movement functionally. So you engage your barrel, your stabilizers, which are these, the rectangle, are gonna be doing their job of stabilizing, while your adductors and your abductors, your hip lateral rotators, are gonna have to do work together. Meanwhile, your whole spine is in a neutral position, which is a huge thing you need to keep in mind, and you're not tilted forward or backward, and you're not gonna be all laterally flexed, so crunching up here. So you're gonna have to do that. And it looks like you're gonna have to move back a little bit more and tilt this forward just like that. Your foot is placed right there, and you are using not your torso, you're not becoming kyphotic, hunchback in the process. So then, go ahead and show that. That's how you're gonna lift. What is happening? Thanks, Desiree. What's happening is your inner thigh and outer thigh muscles are engaging. These are lifting at the same time, and your stabilizers are stabilizing. It's a very difficult move to do. So be careful. If you can't lift yourself up, don't push it, you're gonna hurt your hips. At the same time, did you notice that Desiree's foot was not, the bottom foot was not on the ground pushing her off? So what pushed you or lifted her up was actually the muscles here. So pay attention again. Can we do that again? This time we're gonna do it on the back. You're gonna move that back a little bit. Nice there, here. This is all straight. So her foot is not pushing her up. Can you show it the wrong way, Desiree? Like people do that, using that. You're tilted forward here, right there, and go ahead and lift. That's it. So as you're up there, then you need to make sure you're all nice and strong, and you're keeping, you can go down, that you're engaging your barrel properly. Your body, the whole body is assisting you in lifting, while the spotlight is on your inner and outer thigh working together. Anyway, it's very important to not mechanically try to do something, but functionally try to do it correctly. This is a great exercise for hip stability, for lower back, and the sacroiliac joint. Thanks for watching. Make sure you subscribe to the channel. Take care.